Okay, so some of you know this, some of you don't. I'm Ellie, I'm one of the metabologist. I was talking to Whitney earlier, and I think probably chatting to a few more of you now, the neuro examination station seems to be one of the things that's phasing you all a little bit. So I thought what we do now, if that's all right, is just a quick chat through an approach to the station rather than bedside stuff, which we can do later. But a chat through the things you need to think about, how you might approach it, because you probably know more than you think you do. But it's the thing I know that scares people quite a lot. So if we just run through kind of a structured approach to it, and then we can do questions and things afterwards, does that seem reasonable? And just so as I kind of know what you've all done before, have any of you, I know Whitney's done neuro before, but have any of you done neurology, feel happy about doing neurological examinations or not? Not very much, not. Okay, that's fine. In general. All right. Let's be honest. So probably you just have to approach it the way you approach anything else. So if you're walking into the station and they say to you, you know, examine this patient's neurology, what is your first thought process about what you might think, what you might do, what you might say?
I suppose one part of it was what part of the, whether they want you to a specific part of the neuro exam or whether they want you to look at, you know, the cranial nerves and the upper
and sometimes they will be specific and they'll say that, other times they'll say examine this child's legs. Usually for the purposes of the exam they will do something like that, examine their legs, examine their cranial nerves, examine their eyes. But just say you were going in to do a full neurological examination on someone in an exam scenario, what kind of, or even not an exam scenario, what sorts of things would you do first? So you pull back the curtain, what you can do next?
Look around first.
Absolutely. So the first thing you do is look, okay? So inspection. And by looking around, what do you mean?
So they could have like a special chair, a support chair or something, and you're thinking.
Brilliant. So the room. So chairs, yeah.
walking aids in general, I suppose.
Yeah.
Or orthotic.
Yeah. Brilliant. So that's already given you clues as to what might be wrong with the child. There's a wheelchair in the corner, probably going to be something wrong with their legs. Because it's all really helpful. So yeah, chair, walking aids, orthotics, anything else you might see in the room?
Well, they could have airway problems as well, if it's something generalised neuro, so trachees or ventilators. Or
Absolutely. Hopefully not for the purposes of the exam, you never know. Yeah. Particularly if someone pulls out at the last minute, they have to go and drag somebody off the wall. So ventilators, sort of equipment, general other things, probably is a good way of thinking about that. Excellent. And that, it's good that you come up with that first, because usually that's the thing you have to prize out with people, that they never think about the clues in the room. So really important. So other things, before you touch the patient at all on inspection, you might.
Are they wearing glasses or hearing aids?
Yeah, okay, so if we look at the patient, yeah. So okay, so visual aids, hearing,
One of the first things I always got taught by the GPs who trained me was as soon as you take the child from the waiting room, you look at their gait and how they're walking and how their stance is.
Brilliant. Gives you a load of information. And that's probably same for lots and lots of things.
Yeah.
Because a child with abdominal pain, how they're walking gives you quite a lot of information. So gait, excellent. Anything else? Just looking at the patient.
How they are at rest.
Dysmorphism, exactly, yeah. And what do you mean by how they are at rest?
Whether they're comfortable, whether they look on well, you know, that just general wellness and whether they're well grown. Same sorts of things you do for any exam.
Yeah. Okay. Any specific neurology things you might get just by
Positions,
staring at them?
dystonias, or
So position,
or tremors.
Yeah, so abnormal movements. I'm running out of room now. I wrote too big stuff. So what did you say? Abnormal movements. So tremors. Yeah. similar to hearing gait dysmorphism position you said, didn't you? So sort of, can they sit up? Are they lying down?
Yeah, they could be like frog leg position on the bed or something.
Exactly. And all of those things, although you think when you walk in you just sort of have a bit of a panic attack, they've actually given you quite a lot of information. So if you say what you see, you've told the examiner that you actually this is important stuff and you've noticed it, great, tick the boxes. This person knows what they're doing. So position, yeah, abnormal movements, what else have we got? Other things you can get.
Obvious, like the patient with nerve palsy are obvious kind of signs of cerebral palsy. So sometimes you can see flexion, extension, and
Yeah. So I suppose flex posturing or extensor posturing. Brilliant. So those things, before you even touch them, had a chance to make them cry, do anything like that. Okay, so you've looked at them, you've got all of that information, you can assimilate all of that already. It's given you some clues as to what you might need to look for with the rest of it. So what's the next step after you've gone in, you've looked, had a quick look around the room for clues, you've looked at the patient, what are you going to do next?
Hopefully at some point you get introduced yourself and asked if you can examine.
Yeah, that's probably a good thing to say at the beginning. So yeah, introduction. That actually is a very good point. Never ask a child if you can examine them, because if they say no, you're a bit stuck. So you have to find a way of doing it without saying, can I? You just say, I'm going to do this. Okay, you know, be nice and friendly about it, but if you ask them, some of them will just say no, and then you're a little bit stuck, and you spend the first half of the station trying to persuade them to do it. That's one thing I think I probably learned the hard way. So permission of some sort, but just be careful how you ask. Yeah, okay, so we've looked around the room, taken a look at the patient, maybe, maybe not, got some clues from what we've seen already. So what are you going to do next now?
Start with the hands.
Yeah, so you're going to look at the patient in more detail,
It
aren't
depends
you?
on where, actually depends on what,
Yeah.
which part of my
But no, exactly. Starting with hands is usually a good place to start, as you say. You might get a more targeted examination, but yeah, we're going to do the whole thing. Yeah. Okay, so probably this is now kind of inspecting the patient who's exposed more, so you can see all of them. So detailed inspection, I suppose. Does that make sense? So if we're focusing on neurology specifically, do you have any kind of system in your head, any of you, for the things that you know you've got to look for, rather sort of neurology specific things? You've done this a few times. Put you on the spot now.
So muscle bulk, you'd want to look at that.
Yeah.
Things like Duchenne.
Okay. So, yeah.
we look at skin as well. Do you need like neurocutaneous markers?
Brilliant. Yeah. So what do you mean by that?
I need signs of either neurofibromatosis or tuberculosis.
Yeah. And what sorts of
So
things?
cat
you can
hair,
see?
port wines,
Ashen spot, ashen leaf things. What the other ones are? Is that goose pimple thing on the gooseberry thing?
Actually, macular.
Yeah, that one.
How many ones have seen Hamlet? There we go. So
Also the eyes as well, because obviously.
what sorts of things did you see? Anything else on the skin before we move on?
Chagrin, chagrin patches. Hypopigmented patches.
Yeah.
Port wine stains.
Yeah, port wine stains.
So all like other birthmarks. Yeah. Yeah. Okay. Those are really important things for the neurology station. Can you think of any condition that you might be quite likely to see in an exam?
Neurofibromatosis.
Yeah. It's quite common in children, usually quite well. So that is quite a common one that you might see. And they're very often of an age where they're easy to get in for exams as well. So it's always worthwhile going away and looking up all of the bits while we're talking about it, does anyone else know anything that you might or might not notice just by looking at a patient who's got neurofibromatosis? What other things, if you're
They have
thinking...
don't they get Africa?
Exactly that.
And does someone get ophthalmoplegia?
Yeah, they can do, and they get eye signs, but you might not see all of those relevant bits. But definitely, so in any child doing a neurological examination, big head, small head, also gives you a clue about what you might find. You might not notice, and it's sometimes really difficult to judge it just by eyeballing them, but you can always say, I'd like the head circumference and I'd like to plot it. So, which makes you look like you know what you're doing as well, which of course you will do. So in a way that with the cardiovascular station, you always end up saying you'd like a blood pressure, head circumference, height and weight. Okay, so other things, we've got muscle bulk, skin, any eye things you might see from the outside. Any other things? So you're looking at the skin and the neurocutaneous markers. Then if you're thinking about neurology, do any of you split the way you think about it into any particular format? Or can you think of any way that we might do? What is neurology? What are you looking at? There's a big question. Yeah. Okay, more basic than that. If you're explaining what neurology was to a 10-year-old, what would you say to them?
How your brain works and how your brain makes your body move.
Exactly. So it's your brain and how you make your body move. So what things are involved in that? More specifically. So brain, nerves, muscles, exactly. So that.
Oh no, we can't even do that.
And between here and here, the big lot of nerves. Okay.
Fine.
So basically, think about it like that, and have that in your head as a system. That's it. You've got it. Okay. So you've actually touched on some of this already. But if you have that as your rough way of thinking about things, even if you don't remember absolutely every single detail, you probably will remember something about the section, which may then prompt you to think about things you thought you'd forgotten. So we've done as much as you can on inspection from the brain point of view. So anything that might suggest to you there is something not working with the brain, big head, small head, looking at the child, position, posture, those sorts of things. Inspection, spine, what sorts of things might you? So, scoliosis. Scars. Yep. What kind of scars might you see?
So I guess if they've had spinal operations,
Yeah.
Don't know if you'd see multiple LP scars or not.
You shouldn't do. Not unless you were done the day beforehand.
I can see where I've had my blood taken for blood, for doing
I
blood.
was going to say, you might if they've been done recently, which again, if they've taken someone off the ward for the purposes of the exam, yeah, it's not impossible, they might do a plaster on top. You never know. So yeah, scars, surgery. Yeah.
Visualising the scar from the repairs or something.
Yep, exactly. So repair, yeah, definitely. And I certainly got one of those in my life.
So you were saying you have one of those, well, like,
No. But I got one of those in my exam, definitely. So, you know, they are out there. Okay, so we've done brain, spine. Do you have anything else for spine? I'm not sure I can if we're looking at inspection. So now we're doing the nerves bit of inspection. What sorts of things?
this is where you can look at whether it's your upper motor neuron, lower motor neuron, so whether you've got wasting.
Yeah. Okay, so this is stretching my memory. So yeah, wasting, and that tends to be if you've got which, yeah, so muscle wasting. well, but
Yeah.
it's as a consequence of your nerves not working. Muscle wasting, anything else?
Articulations.
Yep. Where does that go?
Lower.
Do all of you understand what that means? And have you all seen
The
it?
muscle is relaxed. You can see it twitching like this.
Yeah. Have you all seen it? Right. And this is just by looking at patient and touching it, so you know loads. It's just about thinking about it in your head. So if you keep that, I'm explaining this to a 10-year-old, brain, spine, nerves, muscles in your head, and then use that as a rough framework for how you're going to think about the patient in front of you. Then when you go in and have your little panic attack, which you will, because everyone does, you can just go back to that and say, no, I know what I'm doing. I'm going to think about it in a sensible way, and then you can say sensible things. So inspection. Okay, so we've done the inspection part, and now it's more about examining the patient further. So, do you have any ideas, keeping in mind our brain, spine, nerves, muscles? About examining the patient, where you're going to start, or what things might influence what you do and how you do them.
It again depends on which area you've been asked to
Yeah.
examine. So
It does, but if we're taking into account, examine this child's neurological system, what things are maybe going to affect how you do your examination?
Oh, they are.
Age, yeah, big one. Can't ask a baby to do lots of the things that you can get a 10-year-old or an adult to do. Okay, so that's going to be the big thing about how you do your neurological examination, which I think is part of the reason everyone finds it so difficult, is that it's not actually one examination. The way I tend to think about it is older children, younger children, babies. So, if you're a baby, old, younger child, say. And older children and adults, in terms of the examination, you can think about fairly equivalently, because you've all done neurological examinations in adults as part of your kind of adult jobs previously. And are you all fairly happy that you know how to do that? Fine. So roughly what age do you think you can do your examination the way you would do it on an adult? Just throw numbers at me.
10-year-old? 11-year-old?
I mean, in a cognitively normal child, it does depend a bit, but probably from about 6 or 7, where you can get them to do absolutely everything. It's always different, as you know, with any child, depends on who they're in. But I usually kind of think about it from about there. So you just have to be adaptable the way you do with any examination, but if you think that's where I'm going to pitch it for you, adapt it if you need to. So this is probably the group that everyone kind of thinks, oh, I don't know what to do. So when they're not kind of lying there tiny babies anymore, but you can't get them to do what you want them to do. So if you think about how you do the adult examination first, the older child one, just tell me what parts of the exam, just throw them at me, it doesn't have to be in any order, just tell me what you have to do. Yeah, okay. Yeah.
You might do cranial nerves at the beginning or at the end, because maybe doesn't it?
Yeah, so cranial nerves. We'll probably have to think about them separately, because they're quite a big examination on their own. So tone, power, reflexes, coordination, and then...
Cerebral signs.
Yeah, and sensation. Okay. So, what do you have to do for all of those if you're doing an adult? How do you examine adult, older child? We use 12, just because we're allowed to do that. How would you examine tone in an older child and adult? What do you do? Anyway, just throw them. You guys at the back, you haven't made as much noise as the people at the front.
It depends if the legs are on, but the arms, just hold the arms and sort of move them around a bit.
Yeah,
But
there you go.
They're splitting it up a little bit.
What do you mean by the wobble? Yeah.
That
So if you lie them flat on the bed and wobble their leg.
and then do anything up like that, then just lift them up like that.
Yeah.
Check the
And then check the leg bones.
Yeah.
and the ankle.
And one thing that's really important about doing that is just look confident. One thing that one of the neurology consultants who taught me when I was a medical student, he used to describe it as mastery of the limb. When he was, it sounds really ridiculous, but actually if you keep that in your head, it's kind of helpful. And that goes to the tone and the power as well. But if you kind of just go up, take it with your finger, and it looks like you're not feeling very confident, just go up and do what you need to do. You're not going to hurt them if you lie them on the bed and just rub their legs in.
Did you say you do pronus then?
Yeah, I tend to. Because it's a sign of increased tone. I mean, everyone, the way everyone does their examination is slightly different. The important thing is that you get it all done and you have a system that works for you. So there's no rule that says you have to do it there if you always feel better doing it somewhere else, as long as you remember to do it. There's no rule that says you must do it in this order, and if you don't, it's wrong. Just, I think certainly for the purposes of an exam, just having a set way of doing it helps you not to forget when you're nervous and stressed. So wherever you normally do it, don't change it now, just do it where you always do it, as long as you always remember. I think that's probably, from an exam point of view, an important thing. Okay, so you've got to do all of these things, say with a child who is 2, just because they're always really cooperative, as you know. But it might not happen in the exam, but it does happen in real life, and you have to know how to do it, or you have to at least know how to approach it. So, how do you think you might examine a child's tone? And a 2-year-old who's kind of being a bit, I don't want to see this young being a bit grumpy.
I suppose in A&E when you get the 2-year-olds that fall over and hit their head, you kind of have to do some sort of neurological examination, but you don't really do it. You just blow some bubbles and get them to know. Then you watch how they move. Really.
Exactly, that's it though. But that's really important because you do things like that and you don't. Well, you can't, can you? Because they don't understand the instructions. So, but you think you're not really doing it, but you are. You're just doing a slightly adapted version for the child's age. So that's exactly right. You have to just watch them, so you can play. But you have to have a considered head on about what you're actually watching them do. So obviously, if they're lying there doing absolutely nothing, it's different from a child who, as you say, is getting up, blowing bubbles, doing those sorts of things. So, tone, things that give you an idea about tone. You've mentioned a couple of them before.
If they're, for example, sat up, or if they're lying and they're
So their position. Another thing that one of you mentioned before was important for most things, regardless of what the examination was for. Gait. Because if you're really floppy, it's quite hard to walk, or you might walk, you look a bit floppy. What might you see in someone's gait if they're the opposite, they're very stiff? What do you mean?
When you get cerebral palsy patients, you have the extension posturing of their legs, they get scissoring where.
Yeah. So you get scissoring. What do you mean by swinging gait?
where they have to lean to one side.
Yeah, sometimes if you've got problems with your hips, yeah. So, I can't remember the word. We'll put swinging gait, but I know what you mean. We'll go away and look up the proper word. Yeah, and circumduction of the hips.
Just if you've got the unilateral.
Yeah.
Region.
Things. What do you say, hemiplegia? What sorts of things might you know?
Circumduction thing is that hemiplegia.
Can be, or it can just be due to increased tone in the hip. And now you've mentioned hemiplegia. What might you see in someone's gait if they've got hemiplegia?
Extension of the leg.
Yeah.
And flexion of the ankle.
They spend on
Flexion of the ankle, and
stance.
you just did it.
Flexion of the
Oh, flexion of the arm, yeah. So you have to look at their arm, and the leg looks stiff. So they kind of get that straight leg with the ankle. suspect that might be the situation, but you're not sure, do you know anything you can do that makes it more obvious?
Make them run with their arms down.
Brilliant! So, it just
Hold their hands as well, so you have to tell them to
so if you say to them, put your arms by your sides
and run.
They're so you need a bit of space.
Yeah.
Put your arms by your sides and run, and you'll notice that once they get a few steps, this arm will do that, and the leg will look more stiff. So if you think, when you've watched them walk a few times and you don't know, get them to run. And then you have to run a few steps, and it does work. Yay! What's wrong with you now? So yeah, see? And this is a 2-year-old who you haven't done a proper tone examination on, but you've got all of that information just by looking at them. Some idea of power, things you can do.
Give them the toys if they will actively pick it up and hold and pull against them.
Exactly. So yeah, that's the other thing. You're exactly right. So you go to give them a toy and say, no, it's mine, you can't have it. So you wait for them to hold on to it and then see if they can pull it away from you. So pull away. Can you think of any way you might be able to test whether or not they've got any kind of shoulder weakness? Yeah, brilliant. So arms above their head for some reason. So popping bubbles is a really good one. Yeah, reaching for toys, combing their hair, clap your hands above your head. Silly games, okay? And doing things like that shows the examiner that you know exactly what you're doing. And that you're used to children. Doesn't bother you, you've done this 1,000 times. Brilliant. Okay? So you can do all of it, and you do it every day. You just don't think about it. Reflexes can be a bit more of a challenge because you just kind of have to do them. But again, can you think of any ways you might think about approaching that might make it a bit easier for you?
You can show reflexes on a doll or mum's hand or something so they're not scared of the
Exactly.
tender.
And get them to sit with a parent or whoever they're with. So, use parent. Coordination. Your slightly bumpy 2-year-old. Bubble popping. Yeah, see, it's all about bubbles. The world is about bubbles.
But I find balloons quite useful with fingers, like squishing down with those fingers into the balloon.
Oh, that's a really good
It's
idea.
really quite a lot.
So balloon hands.
I usually do that.
Balloon hands. No, that's a really good idea. I've not seen that before.
Because in order to squish the finger down, it's quite a lot of coordination.
Yeah, you have to kind of put it in the right place. Good. So, done quite a lot of things already. Okay, so any questions, anything that doesn't make sense, anything you want to go over again before we finish? It's fine. You can ask me anything, even if it seems really, really silly. No
What would
question
you
is
say
silly.
at the end of seeing a neurofibromatosis patient to sum up what you would like to do next? And because it would be like, oh, I'd like to do an abdominal examination after my, all that kind of stuff. What would be your spiel?
What would you say? Okay, so if you've got an NF patient and you've done the neuro,
Yeah.
so what sorts of things might you have found? But that's real kind of icing on the cake territory. The most important thing is looking at the patient you've got in front of you, doing your examination, being fluent about it. So if you have that as your system, brain, spine, nerves, muscle, and keep this in your head, you will do it all. You will do it in an order that makes sense, and at a time when your brain feels a bit kind of scrambled, you'll have your process and you will just work through it. Okay? Does that all work?